Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today, we're discussing what you need to know about stem cell therapy in Pakistan. This was the webinar presentation, but we had close to 1,000 people sign up, and it basically crashed the webinar software. I apologize. So that's why I'm recording it here, and we'll email it to everyone to view. If you have questions, please email any and all to info@r3stemcell.com. I personally will get to those if it's answerable. And happy to help. All right, we're going to go through what makes international stem cell procedures different than what is available, say, in the United States. What kind of biologics do we use? Where do they come from? How do they work? Will stem cells cure my condition? Do the number of stem cells matter for treatment? What kind of outcomes can I expect? And for how long will they last? What are the risks and side effects? It's important to know. And a little bit about how we came up with our pricing. Are there any extra fees when you or a loved one signs up for treatment? A little bit about R3 Stem Cell. I created R3 Stem Cell. I started the company 12 years ago here in the United States in Arizona. I was in business school. I created it as a fake company for a class. And then all my professors thought this is a great idea. It's an up and coming future type field. So I made it a real company. And here we are, 12 years, 23,000 stem cell procedures later. We've won a lot of awards. I've presented all over the world on various topics. And it's been super exciting to see how well our patients have done in the 6 countries that we're in. We've been in Pakistan for 5 years now. We have our hospital in Islamabad that we started with. Now we have a new center in Karachi. It's gorgeous. I'll show you a couple pictures in a bit. We treat over 70 conditions globally. We'll go through some of those. We've had no significant adverse events worldwide. I'll knock on wood. We have had a few allergic reactions to one of the preservatives in the products. Those have been knocked out very quickly with epinephrine, but that's the worst I can think of. We're on the cutting edge of regenerative cellular technology, and we have been for the last decade. We know there's a lot to consider when a patient is thinking about a regenerative, stem cell therapy, even though it's been, a dozen years for us and, it's old hat, so to speak, but it really does still represent new technology. Patient education is key to helping you make appropriate healthcare decisions. You really do need accurate facts. There are so many centers in Pakistan, Asia, globally, who do patients a huge disservice by disseminating misinformation about what they can do for you. They're providing falsehoods and perpetuating myths and things like that. So we have, since day one, tried to present accurate information like I'm going to do, here today. What makes international stem cell procedures different? So in the United States, we have this beast called the United States, FDA. They are very, very strict, and for a reason. They're trying to help, maintain safety for patients. Their budget is $8-9 billion, and they're very restrictive. Outside the United States, there is less restrictiveness, such as in Pakistan. Commercialization, as is common, gets ahead of clinical trials, and that's not necessarily a bad thing, unless it bypasses really, really good quality assurance. Okay, which means some centers are providing stem cell therapies that are not properly safe. The biologics internationally can be cultured, which is fantastic. We do that so we can offer lots of stem cells more cost effectively. The applications that we can do are a little bit different. I'll show you in a second what I mean by that. The price at some centers, like in Panama and China, is 3 times what we charge. We have very, very high volume, so we've used that to leverage and bring our costs down for patients, which is a pleasant surprise in any country that we're in. Here's an example. This is one of our anesthesiologists, Dr. San Miguel, doing an intrathecal procedure on a lady who has had a stroke in the past. We don't do those procedures in the United States. The FDA doesn't like us to do that. I don't really know why, because it's been very, very safe and effective. But these are things we can do internationally, that we don't do in the States. What kind of biologics are we using? We get asked every day, are you using aborted fetuses? The answer is no. We are using birth tissue from consenting donors after a scheduled C-section procedures. Normally, the umbilical cord, the cord blood, the placenta, all that gets discarded after a C-section procedure. In this case, it doesn't. The women are consented, they're heavily screened prior, and we basically get the birth tissue, such as the umbilical cord tissue, and we use the Wharton's jelly. I'll show you anatomically where that is here in a moment, which has really, really high quality mesenchymal stem cells. We use exosomes from the umbilical cord, and this is called allogeneic tissue from a donor. All right. They are not going to be related to you. They don't need to be. There is no rejection that occurs. And the tissue has an amazing amount of mesenchymal stem cells, growth factors, cytokines, exosomes that are good to helping you repair damaged tissue. I call it a virtual orchestra of regenerative elements. Why do we use umbilical cord stem cells? Well, the umbilical cord stem cells are potent and pure, and really, really effective for the conditions that we treat. Here you can see a cross section of an umbilical cord where you can see the two arteries and a vein. We do use the cord blood from these vessels, all right? So we extract that, and then we remove the vessels, and then we use this flesh-colored tissue called Wharton's jelly. It's like a gelatinous matrix of tissue that has millions and millions of stem cells, billions of exosomes, growth factors. So it's a very impressive source, much better than the autologous, which we'll talk about in a moment. Okay, we do culture the Wharton's jelly stem cells in a clean room that's CGMP compliant. Our clean rooms are ISO certified. We keep the culturing to the third passage, third generation or less. The International Society for Stem Cell Research says you should definitely keep it to the sixth passage or less, but we only go to the third. These are very pure and potent stem cells. We don't use any DMSO preservative anymore. We only use trehalose and glycerol, which are both completely harmless and helpful to maintain the viability of the cells. And you'll see in a second just how high our stem cell viability is. Here's our FDA registration for our sister lab, which is Bello Bio, at our headquarters here in Scottsdale, Arizona. We have listed the sources that we use, the cord blood and the cord tissue. And below, you can't see it here, but we list the name of the products that we're manufacturing. We also have free sales certificates for these products so that we can export them to Pakistan and other countries that we're in. Here's an example of why we don't use your tissue, bone marrow or adipose, but this is for a bone marrow. Look at this. So when you're born, your bone marrow is pretty healthy. 1 in 10,000 cells in your bone marrow is a stem cell. Look what happens at the age of 30. It goes down to 1 in 250,000, so a 25-fold drop. By the age of 50, 1 in 400,000, a 40-fold drop. And by the age of 60, which is how old a lot of our patients are, it's 1 in 2 million. It's a drop of 200-fold. It's like a needle in a haystack. Why would you use that kind of a procedure? It's mostly just blood that you're getting out of the bone marrow at that point. It's like a glorified PRP procedure, and it can be very painful to get the needle. It's a big needle stuck into your pelvis. So for years now, we use a lot of exosomes along with the umbilical cord stem cells. Exosomes, in this case that we use, do come from umbilical cord stem cells. They are byproducts of them. They are acellular. They don't have a nucleus. They don't replicate like a cell would. Basically, in the top part of the cell here, you can see that they're forming bubble type structures, and those bubbles have a lot of exosomes in them. And routinely, they get extravasated from cells, and you can see exosome here in the middle in the extracellular area. It could be in blood, it could be in urine, saliva, all types of bodily fluid, and they look for recipient cells that have inflammation. They get eaten by them. The exosomes then get released and their contents go to work with what's called cell to cell communication. They will tell damaged cells, look, you're damaged. Here's the toolkit you need to help repair and regenerate yourself. So we've been using them for years. And here's the study that really sparked off their popularity. Back in 2005 at Stanford University, they did some studies using a thing called parabiosis. That's where you sync together two animals' blood supply. In this case, it was mice. They gave old mice a skeletal muscle injury. Then they spliced it with either another old mouse or a young mouse. When they connected it with the young mouse, the muscle injury healed like gangbusters. If they connected it with an old mouse, it didn't heal well at all. So the question is, what was happening? Why is that the young mouse compelled the injury to heal? Well, what happened was they did the study again, and they radio labeled stem cells from the young mouse to see if, okay, maybe the stem cells are showing up in the injury and helping it to heal. No, none of the stem cells showed up in the old mouse. So the question is, what is it about the blood from the young mouse? And the theory, here we are almost 20 years later, is that it is exosomes from the blood. So they've repeated this study many times, either with a stroke model in mice, heart injury in mice, other things. And every time it works really, really well. So exosomes are now being called the fountain of youth. And we've been using them for years to provide this. We call it the 1-2 punch, where exosomes act pretty fast. Okay, they give quick result. It doesn't last, really, really, really long. But then the cells start to pick up their activity and provide a much longer term of benefit. All right, so we feel so strongly about it that anybody in our clinics who gets more than 60 million stem cells, will give free exosomes too. And others, it's included in the treatment regimen to give that 1-2 punch. Okay. We get a lot of competition saying that our stem cells are not viable. So to counteract that, with pretty much every batch, we run viability tests. The product gets produced, it gets cryogenically frozen, and then after you thaw it out, that's when you want to see how many stem cells are there, what's the percentage viability. Routinely, we're between 95 and 97%. This was done just a couple days ago. It's 96%. Very, very high viability, and that is exactly what you want. Okay. Where do these biologics come from? All right, so once again, we use consenting donors after a scheduled C-section. No aborted fetuses. Normally, the birth tissue gets discarded. This way, because it's scheduled, we have time to do a maternal screening. It's a very large questionnaire. Do a consent form. The yield is much higher when it's a controlled situation. And then also, it's a lot more sterile than a vaginal birth. So here's an example of a certificate analysis from our lab at Bello Bio. We evaluate for everything the FDA requires, and then some: CMV, hepatitis, HIV, HTLV, syphilis, West Nile virus. We also send 20 vials to a third party to look for bacteria as well as endotoxin. And they grow it for 14 days to make sure there's nothing there. And then our medical director reviews everything, and then hopefully signs off on it if it's all clean. If not, it all goes in the discarded pile. The safety of the products we use at R3 Pakistan is equitable to FDA standards. We produce pretty much everything in the United States. We do have a lab in Pakistan that does some finishing of products. Our lab and facility is FDA registered here. It's the highest quality assurance you'll find globally. Every product is FDA registered. We have free sale certificates for our export. Will the biologics cause a rejection reaction? Is there that potential? The answer is no. The umbilical cord stem cells that we use are immunologically privileged. That's what scientists call them. They don't have MHC2 markers. Those are the ones that would cause a rejection reaction, and they're not there, so it doesn't happen. Okay, exosomes don't do it either. Exosomes don't, also don't have the MHC2 markers. So they don't have that issue either. Here's one study. I could show you 12 studies that I have, but this is just one showing that these Wharton's jelly stem cells are not tumorigenic. They don't lead to cancer. Okay, patients ask us that all the time. It's the embryonic stem cells, the ones that come from aborted fetuses, that could cause a tumor, but these don't. So there's no animal or human study that has shown this to be a problem, and we've never seen it. Okay. Will stem cells cure my condition? This is a very popular question among prospective patients, and the answer is no. We're not doing the type of stem cell therapy with a bone marrow transplant, for a leukemia. In that case, it could be a cure. But for here, we're doing it for kidney disease, diabetes, things like that. Are the outcomes really good? Absolutely. It's great for mitigating the disease for an extended period of time, but it's not going to cure anything, really. If anyone tells you, and I'm sure they will in Pakistan or throughout Asia, oh, we're going to cure your condition with stem cell therapy, and try to sell you on that, it's not true. It's not going to happen, and it's a disservice to patients to say that, okay? It's a falsehood. It's going to lead you to unrealistic expectations. We use the IntelliCell, and this is something that we've come up with and trademarked, and it's the smartest stem cell in the world, the intelligent cell, okay? And this is when we specifically select the mesenchymal stem cells from the umbilical cord that have the highest purity, potency, viability, colony-forming units, which is an indicator of how potent the mesenchymal stem cells are, and we don't go past the third passage of culturing, okay? So how do these work in the body? Well, there's at least 5 different ways we know of that they work, and we'll go through these on the right side of the slide. First of all, they are seekers. Stem cells, the IntelliCells that get, for instance, transfused intravenously, they seek out inflammation. Inflammation comes along with chronic disease. They seek it out. They will enter those recipient cells, or go into the area and just delegate, here's how we're going to fix the situation. They're very, very good at that. If you have multiple conditions that have inflammation in different areas, they'll go to both or several. Differentiation capability. Smart cells have the capability to turn into many different cell types. All right. Not every different cell type, but basically all the pertinent ones that we need them to. These stem cells are very good at persuasion. They're very good and active in cell-to-cell signaling to persuade these cells to turn on their repair processes, which are normally pretty lazy. But in this case, they help amplify them. They are very good promoters. They're able to promote only the processes we want and need for repair and regeneration. This may include new blood flow, new cellular formation and proliferation. When you take something like a steroid for an autoimmune disease, not only are you knocking out the autoimmune problem, you're also knocking out a lot of processes that you want, right? So there's a lot of side effects. It's not what happens with stem cell therapy. We're able to knock out the processes we do not want, but we're also able at the same time to amp up the immune system in the process. So you get the best of both worlds with the promotion. Now, the telecells are also able to shut off with their replication and their repair processes. Um, Unlike embryonic stem cells, they do have a shut-off mechanism so that they don't form tumors. Okay. And one thing I should have listed here, but I didn't, is that these IntelliCells are able to stop a lot of cells from dying prematurely. A lot of cells in our bodies, they have a programmed death and they'll die at a specific time, whether we want them to or not. And why? I mean, if they're still functioning well, why not have them live longer and continue to do what they do best? Okay. That's what these IntelliCells are able to do, is to let them live longer. Do the numbers of stem cells matter for treatment? They absolutely matter. The latest data on conditions shows that to a point, higher numbers are better. All right. Now, there is going to be where you reach diminished utility. More and more cells is not going to be better, but predominantly anywhere from 1 to 5 million stem cells per kilogram is going to be appropriate depending on what condition you have or conditions and how bad those conditions are. We've been doing this a very long time. We have very, very good educated guesses, if you will. But in this case, we do know that anything more than 100 million stem cells per procedure, maybe 120 million if it's given in two separate injection part of it and it's nebulized or whatnot, it's just not a good idea. And the reason is because we don't know how many stem cells the body can use at any one point in time. So if you give hundreds of millions at one time, probably not the best approach. We tend to break that up into separate days for safety and for most optimal, effectiveness. One more thing. A lot of centers will give you not enough stem cells and they'll charge you way too much. The most prominent reason that we see patients who failed treatment in the past is because they didn't get enough stem cells and they paid too much for what they got. All right. So it's unfortunate, but a lot of centers don't have the economy of scale that we do. They can't provide you the effective amount of high cells for a cost effective amount like we can. Okay, so when you look at the conditions that we treat, there are over 70. I've broken it down into various categories here. Although I did want to put at the top autism and CP, we treat a lot of these patients and we get unbelievable results for behavior as well as communication in these children. We do a lot of neurodegenerative procedures, such as for stroke, ALS, MS, Alzheimer's, orthopedic for arthritis, sports injuries. The results are fantastic. Pulmonary, whether it's COPD, pulmonary fibrosis, post COVID lung disease, results are really effective. Autoimmune diseases, there's a lot of them. I mean, diabetes is actually an autoimmune disease, Crohn's disease, IBD, Hashimoto's, scleroderma, there's a lot of them. But as I mentioned, the stem cells are very good at knocking out the harmful processes that are affecting you, but at the same time, they don't knock out the helpful processes. Okay, so they're selective, they're very smart. I put urologic here because we do a lot of erectile dysfunction procedures. It's one of the most common reasons we get contacted. We're very cost effective with it. It's very effective, very effective. We do well with type 1 and type 2 diabetes. We do well with ophthalmologic issues. We do not inject directly into the eye. That has risks associated with it unnecessarily. We'll explain to you how we do that effectively for the eyes. We do a lot of kidney, heart, and liver procedures. We have lots of consumer guides that I've written. It includes the latest research, the outcomes that we see. If you go on our website, r3stemcell.com, you scroll down, there's a lot of consumer guides that they're all free. And also there's a free book that a patient wrote about their treatment with us. We didn't ask him to write a book, but he did so well. He was so happy. He wrote a book. So you can download that. It's short. It's about 40 pages, but it's amazing. All right, our new center in Karachi. It's very attractive. Here you can see it's so new. We haven't even taken the wrapping off of the some of the chairs and stuff, but it's very attractive. It's very well equipped, um, and it's right there in a nice area of Karachi. What kind of outcome can I expect, and for how long when you get a procedure? It's a very loaded question because there's not a black and white answer. You're different than your neighbor, and they're different than their neighbor. So it's not that everybody does the same. Your body's going to be different, your condition's going to be different. But suffice it to say that our overall patient satisfaction is 85%. That means we ask patients at 1 year, would you have it done again? 85 out of 100 say yes. For arthritis, it's much better than a steroid injection. Steroid injections have, side effects. There was a nice study in Pakistan done a few years ago where they looked at steroid injections for knee arthritis, and those patients ended up going to surgery faster because of the damage that steroid injections do. So, our injections with stem cells typically provide over a year of benefit, often 2 to 3. Now, there are some conditions such as stage 4 kidney failure, things like that, where patients are probably going to need a repeat procedure every 6 to 9 months. And the reason is because these are very severe issues. We're trying to keep you off of dialysis. Or for liver disease, some of these patients have been told by their doctor they don't have any other thing to offer. Okay. So you have to understand it's not a one and done for the most part. So being cost effective is very important. And we are, I strongly feel, the most cost effective regenerative stem cell therapy provider in the world for what you receive. Now, I feel so strongly about that. We will price match anyone out there if it's a product and service. Okay. So rest assured, we got you on that. What are the risks? Well, these are very safe procedures at our centers. We've never had a rejection reaction. We've never had a disease transmission. It could theoretically happen. We've never had a deep infection. It could happen, knock on wood. But you've seen with the testing that we do for the 2 weeks of checking for growth. Now, what side effects could you see? A low grade fever, maybe some dizziness, itching, lightheadedness, nausea, some chills. Usually these resolve within a few hours to a day. We also, as I mentioned, have had very, very, very rare allergic reaction to the preservative, and we just knock that out with some antihistamine or an epinephrine injection. That knocks it out within like 2 minutes. Why consider R3 stem cell Pakistan for your regenerative care? Well, lots of reasons that we've discussed. Our outcomes are second to none. A lot of our procedures come from patient referrals. I think there's no better compliment than that when someone does well and sends them a friend or a loved one. We love to treat them and get the same outcomes. Your experience, we do have a patient concierge representative who will help you along the way. We have very contemporary, comfortable medical clinic settings at our 2 locations in Pakistan. You'll receive a customized regimen for your stem cell therapy with exosomes. Our providers are very experienced. We've done the most procedures in the last decade of any stem cell centers worldwide. Our safety history is unparalleled, and we have the IntelliCell. Nobody else has that. Experience matters. We've been in Pakistan for over 5 years. We've been worldwide for 12. We have over 20 customized protocols that we'll put into place for what your need. We're a trusted provider around the world, 6 countries. Unparalleled quality assurance. I showed you the way that we do it. I'll just give you another example. At our lab, we do our particle counts every 10 minutes. We have a real-time sensor for temperature, humidity, and particle counts. Most of these labs around the world, they do their particle counts every 6 months. They just don't monitor. If things get out of whack, they don't know. They don't check it every day, every month, right? So we do every 10 minutes. Once again, you can see on the left our viability, our latest testing showing 96%. On the right, we sent our exosomes out to a third party, and you can see per cc of our exosome product, we have 25 billion exosomes. That's the most concentrated product known to man. Nobody else has developed that kind of a concentrated product. 25 billion exosomes per cc. How do we come up with our pricing? I'm not going to list specific pricing here. Everybody gets a quotation after the free consultation. But suffice it to say that I wanted to provide the Mercedes of stem cell therapy for the pricing of a Ford. Okay. In Pakistan, you could call that a Moran, or something that's on the lower end. But we want to give you the highest quality for the most affordable. And that's what we've done. Okay. Our mission is to make effective stem cell therapy available to virtually anyone who truly needs it and can benefit from it. We do have a few extra fees for sedation. If it's an intrathecal procedure, we need to bring our anesthesiologist in. If there are extra days, there's a minimal amount. We try not to nickel and dime anybody, okay? So it's not much. Now in Pakistan, we have two locations. We have a medical center hospital in Islamabad. We've been there for a long time. And then a new location in Karachi. We also do a lot of aesthetic treatments for hair regeneration, facial rejuvenation, and more. Laser hair removal, filler, Botox, things like that. Okay. It all starts with a free consultation. You can have it in person with one of our doctors. We can do it virtually. Not a problem. The patient concierge representative will assist you with the travel logistics. If you're flying in to see us, we'll pick you up at the airport. We'll take you to the hotel and back. If you have enough stem cells with your regimen, we'll give a free hotel as well. And once again, the advantages with us are unparalleled outcomes. Our safety is the highest quality control you can imagine. We will give you this amount of cells you need. The IntelliCell is ours and ours only, okay? And our pricing is going to be the most affordable, and we will price match. If you've had other consultations, we just need to make sure it's an apples to apples comparison. All right, so start the process today. It's a free consultation. Call this number that you see here. Now, you can also email info@r3stemcell.com. Email that if you want to set up a consultation. Make sure you provide your contact information. We'll reach out. Or any questions you have after seeing this video, just let me know. I'll try and respond personally if it's a scientific question. If it's logistical, then I'll have our lead team, reach out to you. But my goal is to get you the education that you want and need that is accurate. Okay. So many centers in Pakistan will give you inaccurate information just to try and make you come to them. It's a humongous disservice. We want you to have accurate information, all right, accurate expectations of what you're going to receive so that you understand that what's real and what isn't. All right. Thank you so much for watching this presentation. We look forward to speaking with you.